One misconception that we talked about ahead of coming on is the misconception that a lot of patients have around insurance. So, what is, from your perspective, what's kind of the biggest misconception that people have around insurance? I think, at least my experience in working with dentists and then my own experience with insurance is I kind of thought dental insurance works a lot like health insurance, but they're completely separate products.
Yeah, it's so much, it's so different. But oftentimes people think that their dental insurance would, if a procedure is recommended, that the insurance will cover it totally. No, it doesn't work that way. And so there's a misconception there. And sometimes we'll quote this, they'll cover it 60%, but it comes back only covered at 40%. And that's really hard for us to then go back to the patient and say, oh, your insurance only covered this amount. And they're going, but you told me they would cover this amount. And I don't have anything to combat that.
And so, what are the limitations of dental insurance? You talked about it only covering a certain percent, but I know that there's like max payments, and obviously in
Yeah.
health insurance, it works kind of the opposite, where you have a minimum that you or a maximum that you can pay. But it seems like for dental insurance, it's kind of a maximum that they're willing to pay.
Yeah, to me, sometimes it's like the insurance is only based on the actual plan terms and not what's best for the patient. Yeah, but then we got waiting periods. Then we've got they'll downgrade fillings from a beautiful white composite filling and say, oh, we're only going to pay based on a silver filling. And those are just ways the insurance company runs my dental practice. And I hate to say it like, we see it daily. And it's like, just the example I gave there. And sometimes they said, oh, this tooth may not need a crown. It needs X amount of destruction or decay. And clinically, you have to do what's best for the patient. And I can't, my hands are tied sometimes as far as the payment or the reimbursement, but I know what's best for this patient and I know what's going to last the longest and give them the best care. And sometimes that's not what the insurance wants to do. They just want to get by, not pay a whole lot. And so who loses? The patient, number one.
Yeah. Yeah, the patient probably is the biggest loser, and then you as the dentist are kind of in next, and the only real winner in that situation is the insurance company.